What's up, you lazy, entitled, basement-dwelling millennials, bootstrapping boomers, apathetic Xers, and goddamn Gen Z kids today? I forgot what our catchy title was going to be for this one.
We did not really make one.
Yeah.
I just don't really have a really catchy, pithy type of like.
I thought I came up with one on the fly last time. So we already recorded all of the 3 episodes, and then my mic wasn't turned on. So
Yeah, I think there was some deliberate sabotage by our producer here to avoid himself being outed as a clumsy office chair sitter.
He fell
type
out of his
person.
chair and it was caught. I don't know. Otherwise, it's government conspiracy, man. They're
Right.
trying to silence me.
That's right.
Anyway,
But, our topic is healthcare in America,
Yeah.
around the world, as a part 4 of our series of the American Dream, and if it is there at all anymore. And part of that is obviously existing in the world, which generally requires some level of healthcare
yeah.
to either fix your broken body or, something that ours doesn't really do is hopefully prevent you from getting sick in the first place.
Well, if they prevent it, then they can't sell you a bunch of pharmaceuticals and
I
give you
know.
expensive
It's a
procedures to
novel
bankrupt
idea.
you.
It's a novel idea.
So, it's a lot more profit to be made on the actual getting sick part than preventing the getting sick part.
Right. Which is why the proliferation of the pharmaceutical industry has been so insane, because they don't really focus on prevention. The biggest thing you can do about that is take some vitamins every day.
Get them Flintstone gummies out.
Right. Yeah. Always get the chewables.
Anyway, so healthcare. How do we do healthcare in the United States?
Badly.
Horribly, horribly. In fact, of the industrialized world, we do healthcare the worstest.
Right. What is the group that is, we talked about OECD countries, basically is a organization of economically countries who
advanced.
Yes.
High GDP countries, I suppose, would be.
Yeah, basically, if you consider them first world, most of the first world-ish type countries are part of this
developed
economic organization.
And yeah, what do we rank on there? I thought we had it down here somewhere.
Well, we're bad. We're like the worst of all the OECD.
50.
countries.
Oh wait, no, that was mortality.
Yeah, all the OECD countries were the worst. We spend more and have worse outcomes than any other of those countries.
So how did we come up with such an impressively horrible healthcare system? And capitalism is, as always, the answer.
Yes.
Healthcare in the United States is very much run by the private sector. It's a for-profit industry, basically across the board, even where the government is involved in like Medicare and Medicaid. A lot of that is subcontracted out to for-profit organizations. And then we have private insurance that you have to pay for huge premiums, or you have to hope that your employer does that for you. And insurance companies are always looking for reasons to not pay for you to get health care. They want to take the money, not spend it. That's the entire purpose of an insurance company, is to take as much money as they can without actually providing anything for that money.
That's the profit motive.
Yes.
Just to give you an idea of how like American our system is, how privatized healthcare is so American. Basically the original private hospital that became like very prolific was founded by the then owner of KFC.
Need to keep these fuckers alive longer so they can eat more KFC.
HCA, the Hospital Corporation of America, was founded in part by
Colonel Sanders.
Yeah, basically. Like, this is America. Or, it's really,
Would you like a side of gravy with your insulin?
Actually, that'd be kind of tasty right now. I'm a little hungry.
I am
Not
too.
gonna lie.
Oh wow, I did not know that. That is fucking
I think I
hilarious.
actually mentioned this on one of our first few episodes, like right away when we first started,
Oh my
but
God.
because it was just we were just broadly talking about
Mhm.
benefits of like working in healthcare, but
But
yeah.
Colonel Sanders started privatized healthcare.
Yeah,
My
like
God.
Jack Massey or whatever his name was. Yeah, he started he started the first private hospital corporation essentially.
Oh man, fuck him.
Yeah, it's pretty classic American,
That is the most
American success story,
uh,
right there.
one of the most unhealthy fast food chain owners in the in the world is like, you know what we should do? Pay people to get treated for all of
Well,
the
no, they
ailments
were
they
like,
get from eating our food.
they're like, this is such a good business model that we have for Kentucky Fried Chicken. Let's do that for hospitals. Yeah, that was like their thinking.
Yeah, I mean, it sort of makes sense, if you want this extra health care, it's like a side that you got to pay extra for, you know.
Yeah.
um,
So yeah, Americans do it differently. We do
yeah,
it KFC version.
we really do. We're the only country in the developed world without universal health care of some sort. And a good portion of our country lacks health insurance. I was many uninsured are in the U.S.
That's got to be a skewed number because of
Um,
the HCA and
yeah,
Obamacare. But
yeah. Well, this is in 2022, 26 million people were uninsured.
yeah, that still seems crazy high.
Yeah, 8% of the population. And that's uninsured. I mean, how
Right.
many of
People are underinsured, or
underinsured
just like
yeah.
have the bare minimum plans.
HSA, what's your deductible on your HSA?
It's like $3,500.
Yeah. And that resets every goddamn year.
Yeah, yeah, or it might be even more.
I was gonna
But
say $3,500 really ain't that bad
it's
for a high
that's
deductible.
not the out of pocket max
Mm.
though. That's just the initial deductible.
Ah,
Yeah, when you start want to talk about some plans, like they find so many ways to
oh my
eke
God.
every dollar out of you.
Well, it's like a talking novel every time you try to go through the policy, and they're
Yeah, it
like,
takes like an hour for them to
Mhm.
like your employer to have somebody from the insurance company be like, "This is your insurance plan for the next year," and it's like an hour to 2 hour long meeting.
yeah.
Like
And
them
then you're
just
still like, I have no idea any of the words you just said.
right. They're like, "Which plan do you want?" I still don't know.
I don't-
what
I
the
don't
fuck difference
understand.
is. This one costs a little bit more, and this one costs a little bit less. That one has a higher deductible. This one has a lower out of pocket maximum. Like
Mhm.
it's fucking insane.
Yeah. Yeah. And then heaven forbid you try to read any of the shit yourself to figure it out,
Right.
And then they act like they're giving you options. It's like you've got the option between shitty and also really shitty.
Right. Yeah. Well, I mean, that's the American way, the illusion of freedom, right?
Mhm.
That's why we have like 10 brands that make all the consumer goods
Yeah.
that we consume.
The United States spends more on healthcare. So we have the worst healthcare. We have
Yes, out of all the OECD countries, we have the
Mhm.
worst, but we also spend basically per capita like 6 to 7 times more than
Mhm.
any of those
and
countries.
that's government spending. That's not including
I think that's including private spending.
I mean we spend more in government spending too than
Oh,
any
yeah,
other
yeah, that's true. The government
Mhm. Like-
also spends more somehow on like a tiny sliver of services that it
Mhm.
provides.
So like your tax dollars are still paying for this shitty healthcare. So like obviously we're doing it wrong. Is anybody doing it righter? And the answer would be yes.
Yeah, so basically almost all of Europe has some sort of universal health care, whether that would be an actual like socialized medicine where the countries themselves, the government owns the hospitals,
Mhm.
or they offer some sort of socialized, universal insurance.
Right.
So like there's a lot of different ways to do it actually.
Be like Medicare for all would be like a socialized insurance where you'd still go to probably private providers and stuff. Where a
yes.
socialized, a completely socialized healthcare system would be the government owns the hospitals, employs the doctors.
Right, it would be like the UK
Yeah.
with the UNH or whatever it
Mhm.
is, UH.
And so and then some countries have a mix of both. Like I think Canada kind of has a mix of both.
Yeah, I'm not too sure in
Mhm.
Canada, but they still have better health outcomes and it costs less
Yeah.
um, for them. And so, also, crazily enough, there are 72 countries in the world that have some sort of universal health care.
72.
I mean, it doesn't really surprise me considering like the United States is one of the only countries that is like, nah, food's not a human
Yeah.
necessity, you
Yeah.
know? Like we're that guy.
Mhm.
But so it doesn't really surprise me that we're one of non 72 countries that don't have universal health care. So like
We're the richest third world country in the world.
that's honestly pretty accurate.
Mhm. Um
Unfortunately.
Yeah, so yeah, right here. So you had in 2022, the US spent $4.5 trillion on healthcare. And I think like over a trillion of that was spent completely oh yeah, 1.8 trillion a year in federal spending and 4.5 trillion in total spending. So
Right.
the government spends over almost $2 trillion a year of our tax money
Right.
to pay for horrible health care. And then the rest of us spend another $3 trillion a year in insurance payments
Right.
and out of pocket expenses and, pharmaceuticals and all of that kind of shit.
And so to be fair, like that
Hmm.
1.8 trillion in federal spending, that is basically all of Medicare and all of the VA costs.
Yep.
So like that's still probably what 25% of our population
Yeah,
that's receiving
probably.
healthcare
Yeah,
out of
especially
that.
since boomers are getting old
Right.
and getting on
So I
which
mean,
as boomers get old, that number is estimated to go up to 6 trillion by 2027, which is not that far away.
right,
So
we're pretty damn close. So I mean, if you triple that or quadruple that to include every American,
mhm.
we're really not spending that much more money than we are currently in
Mhm.
a very flawed system.
Mhm.
So, like, if the federal government were to take over all the direct spending version of that healthcare system,
Well, we would save
we
money. According to even like
right. No,
a
I'm just saying like
Mhm.
if we didn't foresee any cost savings,
Yeah.
just having the federal government take over the spending, direct spending, it wouldn't be that much of a difference
No.
to have 100% of the United States covered.
Mhm. And yeah, but it would save money. Even the Koch brothers, they funded a
Yeah.
study because they're hell bent on being as evil as possible. And like, hey, we're gonna spend a lot of money that we could spend, maybe helping people get health care to try to figure out why we shouldn't give people health care. And even their study was like, yeah, it would actually be cheaper to just give everybody health care. It
Right.
would save like $2 trillion over the next decade, and that was like again Koch brother money
Right.
figured that out.
Yeah, that's like if you're gonna go off of any estimate, like that
Uh-huh.
is the most conservative estimate that I think you'll find out there.
Yep.
That actually did their work, that didn't just like make up the numbers.
Mm-hmm.
I mean, it's insane how much it's costing people. It's basically we're spending around $13,500 per person per year. Does it feel like you're receiving $13,000 worth of healthcare every year?
No.
No, no, not even close. And we're like, so if there's people like us, and I'm sure
Mm-hmm.
there's millions of people like us that are receiving almost no health care because we're,
Mm-hmm.
in our 20s to 40s and
Drinking
like,
hasn't caught up with us yet.
right, or it's, just about to,
Mm-hmm.
or we're in denial. um, there's almost no cost associated with those people. So that means like the people that actually do need the care, like we're spending
Exponentially higher.
a
Yeah.
fuck ton of money on those people.
Mm-hmm.
And it shows because 2/3 of every bankruptcy in the United States is tied to medical issues,
And
medical costs.
that is just insane. Like, and the people who fight against this the most are always the ones preaching about, choose life. Life is
Right.
sacred.
Pro
All this,
life.
all this
Yeah. We're here
bullshit.
for humans,
Yeah. They're
except
always like,
for,
oh, we can't fund this because homeless people exist. And it's like, okay, well, maybe we should give the homeless people some homes. They're like, well, who's going to fucking pay for it? And I'm like, well, and,
it's all cyclical, but like,
yeah. But like, the fact, like, you just think about that literally millions of people make the conscious decision between death and bankruptcy
yeah.
every day.
Yeah.
Like,
Yeah.
every day. Like, how many people die because they couldn't afford their insulin? And so they're like, I'm going to
Right.
try to stretch it out.
Yeah.
Like, and it's something that is just, and it's pure greed. I mean,
Yeah.
it is pure greed.
Well, I mean, basically
Mhm.
every problem that the United States faces today, socially, is
That's
caused by
fair.
greed.
That
But
is fair.
this
I
is
mean,
this is very it's more evil because it's
mhm.
directly tied to a person's well-being.
Right. Like, yeah, when you're being greedy because you're overcharging for an 80-inch television or something, then like
Yeah,
whatever.
or like your new F-150 costs
Mhm.
$75,000 for a base model.
Right.
You know,
Like that's
whatever. Like you can get by on a used car for time
yeah.
being if you
Uh-huh.
if you don't have the
People
money.
aren't literally dying because they can't afford a new
Right.
F-150,
Exactly.
and that's why like the lack of health care in the United States is murder for US citizens
Right.
quite literally.
Very much literally. Yes.
Lack of health insurance is responsible for 68,000 preventable deaths per year. Avoidable deaths in the United States per 100,000 is over 100 people more than the next highest OECD country. And we're at 325 people per 100,000. So the next one is at uh, uh, right around
220.
200.
Yeah.
Yeah.
And that's the next highest. That's not even the average or the
Yeah.
lowest. That's the
Hmm.
next highest, like the step down on the ladder. We're
Yeah.
we're like
They're the next shittiest country is 100 deaths per 100,000 lower than us.
right. They're 30% better than we are. We are
Um,
the goat of
yeah.
being the like most murdery of our own
Murdery
citizens.
healthcare system out there.
Yeah.
We rank 54th in infant mortality globally. Like
Globally.
54th
Right.
globally. Like that's all the countries. Like they're
Right.
factoring
Could
in
you? I
like
mean, could you even like list 50 countries? I mean, like
no,
I maybe could because I'm a little bit of
no,
geography, like
right.
you guy, but like
But all the stands that you don't know, like we're
no, yeah.
probably below Uzbekistan or something.
There's a number of
Mhm,
countries in the Middle East that have better
mhm.
health outcomes.
We rank 55th in maternal mortality rate. We rank below Russia in maternal. It is safer for you to have a baby in Russia than in the United States as a mother.
Yeah, like Russia, Qatar, Turkmenistan, I think, and
See,
like
Turkmenistan, I told
yeah,
you, the stands.
I'm pretty sure it's
Mhm.
healthy to have a child in those countries than it is
Yeah.
to
Mhm.
have a child in the United States.
It's
On average, right?
uh-huh.
If you're a white middle
Yeah.
class person, then
Well,
probably you might be a little bit better off in the United States.
I mean that's the average, but then like you think about, African American females are
Oh yeah,
like way more. I don't
yeah,
remember what the number is off the top of my head, but I feel like it's like twice as likely
at
to suffer
least
infant mortality
at
than,
least twice.
other races.
Right?
And
Yeah, it's like clearly the
mhm.
like people say, "Oh, we're not racist anymore." It's like, well, you may not be openly racist, like as you're walking down the street, or like there may not be a separate drinking fountain anymore,
Yeah.
but we're racist in the ways that like
Well,
actually affect people
we
and like their
built
lives.
everything on racism,
Right?
and it's like if you built your house on racism and you remodeled some of the interior, the foundation is still made out of the same fucking thing you built it
Right?
on.
Yeah, exactly.
Yeah, but but getting back to this, we rank 40th in life expectancy. And that's actually going down for the first time in history. We're the first generation to not expected to have a longer life than our parents. Which is insane. Like literally every generation, pretty much through human history, I'd say, with probably some exceptions in the
I
Dark
mean,
Ages,
at
but like,
least in the last 200
hmm
years, just say that.
hmm
Like
like,
since the Industrial Revolution.
hmm and obviously that is largely due to healthcare. Obviously, it's probably somewhat due to processed foods and stuff like
Yeah,
that.
I mean,
But
obviously, there's a
mhm,
huge number of factors that go into
obesity is a
determining
huge part of
life.
our health crisis, but a lot of that is also due to not having proper access to healthcare. I mean,
Right.
especially like when you really start to dig down into the meat of it, countries that have access to similar types of food and food options still don't have the obesity problems we have.
True.
And a lot of that has to do
True.
with like, hey, maybe there's, some mental or emotional issues that are driving these things because we've got no mental health care support. And
Right.
a lot of people
Yeah.
eat their feelings. That's a whole thing,
Right.
and there's a lot of reasons to be depressed in this fucking dystopian hellscape that we live in. So
Well,
it's
like countries like the United Kingdom, which is also dealing with obesity, not to the scale of the United States, because
yeah.
nobody else does it like the United States. But they are one of the more obese European countries, but
Mhm.
they're still far ahead of us
Mhm.
in basically every outcome,
Well, and
including
then if
life
you're going and getting
expectancy.
preventative health care and your doctor can be like, "Hey, we can prescribe this medication that'll help you manage your appetite or manage, your weight control." And like, "Hey, if you don't, do something different, you're going to die of heart disease like next year." And
Nah,
like where
just
if
just
you're
take a
not even
pill.
going in for preventative health care, like in the United States, most people don't, and then it affects poorer people more because they are going to eat the cheaper, shittier food because that's what they have an option for, and they
Right.
also don't generally have the access to affordable health care to get that preventative care to be like, hey, you can't eat this or you're going to die.
Well,
You know.
cheaper food, no time for preparation because they are working two jobs
Mm-hmm.
potentially, and so they can't cook their own food, or they're like working at a location that only has a microwave, and so they're
Mm-hmm.
eating microwave meals every fucking day, like shit like that.
They don't get enough time for a lunch break to actually like go out to get food
Yeah,
because
right,
that's not a mandated thing here in the United States
right.
either.
I mean, I was just looking at this like preventable deaths, and it reminded
Mm-hmm.
me of like workplace deaths from
Mm-hmm.
in like the early 1900s,
Right.
and
Like
like
pre-OSHA deaths.
right, pre-OSHA level, but worse.
Mm-hmm.
So, like, if this was happening in a way that was more visible,
Mm-hmm.
like this would be on a scale that is at least as as big as the labor movement was back then.
Right.
In like the late 19th century, which we know was like hugely responsible for workplace safety and like
Well, it's like
preventing like tens and hundreds of thousands of people's deaths.
the book The Jungle,
Right.
Upton Sinclair's The Jungle. I mean, he did not intend that. He did not write that with the intent of reforming like the food industry and bringing around the FDA, which is
Right.
really what happened because
Yeah.
people are like, "Wait, I'm eating what now?
Yeah. Yeah.
Tuberculosis pork? Okay. We can we do something about the
That's the
dude's
flavor,
finger?
though.
Maybe ended
That's
up."
the flavor, the
Uh-huh.
tuberculosis.
But he was talking about how dangerous the workplaces were,
Right.
and that was the whole point of writing the book. But it was like it was a visible thing. A guy wrote an entire like a classic. We're all forced to read,
Right.
not forced to, but we're all assigned to read this in school. Um, and that was his initial motivation. It wasn't necessarily. I mean, I'm glad that it had the impact it did on our
Right.
food industry,
Yeah.
but also like it was like, hey, people's fingers are getting cut off. I'm not telling you that because the finger ended up in the food. I'm telling you that because dude's finger got cut off and he just got fired because he couldn't work anymore.
Right. Yeah. Exactly. Like this is on that level
Hmm.
of just huge impact
Hmm.
and clearly something that we could prevent. That's the
Yeah.
whole point. These are preventable. These are not just people who like are terminal and like we can
Hmm.
extend their lives. These are people
Yeah.
who didn't take their insulin, who
Hmm.
didn't get proper care early enough,
Yeah.
who just like
Didn't get diagnosed for their cancer when it was treatable.
right. Yeah.
Didn't get diagnosed for their high cholesterol before they had the heart attack, where they could have, taken some Lipitor or whatever the fuck they advertise to us, which is another thing
Yeah. Yeah.
that doesn't happen anywhere else in the world, like
Right.
pharmaceutical advertising.
It's never made sense to me. I don't think I've ever asked for any
No, I've never been to the doctor and been like, the television told me to ask you if Lipitor is right for me.
right. You don't have a heart condition. Well, I just wanted to check all my bases,
Yeah, yeah. The commercial was very convincing that
Right.
if I did this, I was going to be able to like sit in a bathtub in a field or
It looked
something.
very nice.
Uh-huh. That was Cialis, but you get
Yeah.
the point.
They're all in a bathtub in a field.
Yeah, it's just weird fucking commercials. God. And like
Right.
and that's the thing is like doctors exist to tell you, like, you shouldn't have to ask your doctor about medication. Your doctor should be like, this is the medication you need because it's my job to know the medication that you need. Like, that's why I went to school for 10, 12 fucking years.
Yeah.
And
I mean, doctors nowadays they go to school and they get told like the how to remedy things. They generally are like, well, you should lose weight and
yeah.
like try to eat better, and then like that's the extent of the preventable health care that they provide. They're like, yeah, just don't
Well,
smoke and eat less steak
yeah.
and burgers. It's like, well, how do I actually become healthy if I'm currently unhealthy especially living in a society that we are today where food is fucked up.
But it goes beyond that too, because like all of like talking about advertising for pharmaceuticals
Hmm.
and things like that, and just the huge hold that the healthcare industry lobby has on American policy and healthcare in the United States, they also lobby to get their stuff into curriculums for medical teaching.
Mm.
Um,
Sure.
uh, Part of the whole opioid epidemic that started in the schools. They were like, basically writing the books and giving kickbacks from teaching
Yeah,
the
didn't they
the
like were like this is how like you should teach pain or
yeah.
pain management
Yep.
and like this is how you
Mm-hmm.
determine what,
They taught that, and then they started giving doctors and pharmacists kickback for prescribing
yeah.
so many and all this, and we like literally got an entire group of people addicted to heroin, because that's what opiates
Idiots, right.
are. I mean, it's fucking heroin. And then we're like, oh shit, we've got a problem. All of these people are addicted to painkillers. Everybody's addicted to Vicodin. And you've got this one pharmacy in Ohio prescribing enough Vicodin for like a town 10 times its size. And maybe we should do something about that. And then they did something about that. Well, all these people are already fucking addicted. And now we've got a heroin problem, because it's like that was the cheap alternative, is you
Right.
got these people addicted to legal heroin. And then you're like, oops.
Yeah, I mean, there can't be enough said about the Purdue and Sackler family, basically self-invention of this problem
Mm-hmm.
and trying to, evade as much accountability as possible. That's a whole pie of its own right.
Mm-hmm. It's. I mean, again, as American as it gets, like
Right.
create the problem,
Yeah.
create an epidemic or an economic collapse or something, and then be like, not my problem.
Right. I didn't know it was addictive.
We have all of this internal documentation from your company that says you did. That was
I never saw that
no.
email. I don't recall.
I get a lot of stuff. I'm a very busy, very
Right.
busy person. My secretary is actually to blame for not bringing this to my
Right.
attention.
Yeah. I mean, it's always the secretary's
Hmm.
fault.
Oh man, and yeah. So this is.
I mean, obviously, there's a human element, right? Of
Hmm.
like, should we take care of our people? This is like, as a society, have we determined that caring for our people and of all class, poor, rich, do we believe that they deserve to have the minimum level of health care, or
I
do
think
we
they
or do we
deserve.
not give a fuck?
I think they deserve to have more. I mean, I think everybody deserves to have the health care required for them to live a functional, comfortable life. That means like dental. I forget what the statistics are, but like not having access to dental care
Mm,
increases a myriad of other health issues,
sure, sure.
like things that you wouldn't even like associate with it. And I don't, like I said, I don't remember what it all was, but it's like I don't know, like it increases like heart disease and shit. Like, and maybe it's because like the food you can chew when you've got bad teeth or something. I don't know, but it decreases your life expectancy to
Hmm.
not have access to decent dental care, and dental care is not considered like
Right.
that's a supplemental care. That's
Yeah.
not even like
Yeah.
something that you don't. That's an add-on for your policy insurance at like a company that has
Right.
good.
Yeah. Medicare does not
Mm-hmm.
cover dental,
Mm-hmm.
which is and old people lose their teeth, so they're like trying to avoid paying for that.
Mm-hmm.
But who knew that teeth were important
Right,
to
I know.
living? It's weird. I just never think about them, but there they are.
There's a guy on TikTok who does medical, like he must be in the medical industry, and he just does a whole bunch of those skits where he plays multiple
I
characters.
love that guy.
You know what I'm talking
Oh
about,
yeah,
right?
he's got the curly hair.
Yeah.
Timothy.
Jimothy.
Jimothy. Yeah. Yeah.
Anyway, and he did one. That's how I knew about like he brought up
Mm.
all the other things that can cause from like dental, and he's like, oh yeah, we don't cover dental, and like yeah, teeth are luxury bones. That's what we call
Luxury
it.
bones. That's pretty awesome. Horrible, but
horrible, but
so
it
accurate.
stuck with me, man, and yeah,
No, he's doing the Lord's work.
he
He's
really
doing the
is, he
Lord's work.
really is, like, God, I wish I could remember what
Right?
his
Wish we
fucking
could
name.
shout him out right now
Yeah,
because he deserves it.
but yeah,
If you're on TikTok, you know
if you're
who
on
Jimothy
TikTok,
is probably,
you know,
or just look it up.
before they ban it, fucking Jeff Jackson. Oh,
Did he get banned,
well, Jeff Jackson,
or did he vote to
he
ban
voted
TikTok?
for it. He voted for it. Not only did he vote for it, Jeff Jackson like built his entire national platform
Yeah.
on TikTok,
Oh, yeah.
being like, "Here's what's really going on in Washington."
I'm the guy.
I'm
and
the guy
telling
who's
you the things.
bringing you transparency. I'm cutting through the bullshit.
Nonpartisan.
Mm-hmm. The other party, like,
Right.
and then so he votes yes on the TikTok bill, and he goes and he does one of these videos, and he's like, I don't believe TikTok is going to get banned. The bill is just trying to force them to sell to an American company because China's an adversarial government, and and he's like, and he's like, and then they put a pop-up up that said that you should call your representatives and tell them to vote no on the TikTok ban without saying what the ban or what the bill really was, because it's not a ban. We're just telling them that they have to sell or they'll be banned.
Right. Yeah. I
And-
mean, there's no guarantee that anybody picks up and actually buys.
Well, they wouldn't sell
TikTok.
it. They would not sell it. The United States accounts for like 10% of TikTok's global market.
Yeah, true.
They
So
wouldn't
we
s-
would just get banned.
Yeah. And so he goes on, and it was just like, so only 65 representatives voted against it, right? There was like
Sure.
overwhelmingly passed.
Yeah.
And he comes on here and does this, but it was so much more of a betrayal from him because he was the TikTok congressman, right? Like,
Right,
he
yeah.
built his whole fucking brand on TikTok. Like,
Yeah.
I did a video about him, like, singing his praises.
Yeah, we've
Mhm.
talked about him a lot.
And then he comes on and does this, and just, I mean, like, I did a video fucking chewing him out, and
Yeah.
a bunch of other people did. Just gets fucking canceled so hard, loses like 100,000 followers overnight, and he dirty deleted the video.
Oh yeah. I
Ugh.
mean, whatever. Like that's
No, without any, like, I would have no problem with him deleting the video had he followed it up immediately with some sort of accountability thing, like, hi, I realized that the video I made was not taking into account the way that many people feel about this, and maybe there was some different things. But he didn't do that. He just fucking dirty deleted it, pretends like it's not gonna like, everybody fucking saw it, dude, and we all know. And
also
then,
that's not how TikTok works. Like
right.
you post it one time
Mhm.
and then it's there forever.
Yeah, like,
And people are gonna stitch the shit out of it.
I did.
Yeah.
Like, I just
It's-
what, and that's what, because he's like, oh, we're just worried about them manipulating the algorithm, and I'm like, Facebook,
Yeah,
like,
Facebook,
we're on
Instagram,
the third
Twitter. Like,
election
what are you
of
talking
Russian
about?
interference via Facebook. It's still happening, and you all have
Yeah.
done fuck all about it.
Right.
And you're here like, oh no, TikTok, which we have literally zero evidence that they've done anything to manipulate. None.
Right. And we have minimal evidence that they even have access to like basic user data.
Right. And
Like it's like, okay, sure, like they
Mhm.
probably know like the
Mhm.
same information that Facebook does about
Mhm.
you, if not a little bit less potentially.
probably less. I mean, it wasn't Cambridge Analytica with TikTok,
Right,
and
yeah.
like, and so yeah, he's just getting. Sorry, that was way off topic. But
Yeah, a little bit. But that's okay. That's okay. It's very relevant to the moment.
yeah, it is.
So getting back to healthcare,
Yo. So like,
turns out it's actually the way that we do things is not only bad for Americans, but it's also bad for businesses that
Yeah,
are
that's-
trying to, do things in
it's
the
bad.
economy.
It's bad for capitalism as a whole. And this is the thing. Like, I try to drive this point home all the time because I think
Yeah.
this is like we can argue back and forth. It's like if you're quote unquote on the left and you believe in extremist ideas, like people shouldn't have to go bankrupt or die.
Yeah, I know that is extreme.
I know it's super, super extreme. Only 72 other countries have subscribed to that extremist ideology,
Yep.
and but like the fact that those lines are already drawn, right? That's the how are we going to pay for it? I don't want to pay for somebody else's healthcare, assholes. Libertarian, conservative
Right.
bullshit.
Yeah.
Then there's the people that I'm like, no, bleeding hearts. Like, I believe in people not dying when they didn't have to.
But how are we going to pay for it?
But how are we going to pay for it? And here's where I think that the argument that really should be talked about, because you're not going to change either of those people's minds, right? Like those
No,
people have ideological positions.
Either they care about people or they say fuck you. Like, people, pick yourself up by your bootstraps.
Right. It ain't my responsibility to pay for your health care, right? That kind of bullshit. Even though that's how insurance fucking works. Like you're paying.
You're already doing that same thing, just in a more roundabout way that allows for insurance companies to make profit off of you not caring.
Mm-hmm. With a lot, I mean, like that's like half of our healthcare expense is just insurance companies. Like it's administration. It's people. Hospitals have to hire entire teams of people with entire salaries, full-time staff. That's millions of dollars probably per hospital per year. Right. That is just people figuring out how to bill the work that they're doing to the insurance company. And then the insurance company hires an equal number of people. That's entire job is to be like, no, we're not paying for that. And they go back and forth.
That's not the right billing code for that ibuprofen in that setting. The ICU ibuprofen is a different billing code than the just normal ibuprofen.
Yep. And all of those people go to school to learn how to do that insurance billing and coding and bullshit. So you've got entire people who had to get a degree to do this, and that's what your insurance premiums are paying for. It's not really paying for your health care. It's paying for people to try to not pay for your health care. Like that's the whole point.
Yeah. So putting that all aside, best point for why we need a centralized either insurance or socialized medicine in the United States is that it actually helps the free market work for businesses, small businesses, and just any business.
Yeah. If you love capitalism and you're a true red-blooded free market American, you should hate privatized healthcare, because privatized healthcare is the most anti-free market thing that we do in this country. And I mean, we do a lot of very anti-free market shit.
Very true.
But small business, we always talk small business is the backbone of America. Support local companies, all this kind of shit. Private healthcare is just anti-American at that point. Because if you need healthcare, which most people do to live,
it's helpful.
You are either spending massive amounts of money out of pocket,
right,
or you have to work for somebody who's going to foot that bill for you. And most people, like, how many people don't go start a small business because they simply need healthcare and they can't afford to not have healthcare to start a small business? How many people work for these massive corporations? And that's why these massive corporations don't mind eating this healthcare cost.
Right.
Because that stops competition from forming. That stops them from losing
and it
talent.
Controls people, from leaving to go to a job they like better or starting their own business or just, doing something that's more productive in the way that they feel is more productive.
And then
it traps you.
It absolutely does. And then, like, let's say, like, one of us, we're young, healthy enough, and we decide we're going to take the risk and go without the health care for a while to start a small business because we feel we can be successful, which is, like, I've spent most of my life without health care because I've always worked for myself, and I've been fortunate enough that I've gotten by with it, but
you've been rolling that dice.
Yeah, But let's say you get to that point, you start your small business, it's going well, now you're trying to compete with bigger businesses, which is already hard enough to do for a small business.
Yeah, right.
But the biggest thing about being competitive is having a competitive labor force, like having access to quality employees. And there's a lot of quality employees who would be like, I would love to work in my hometown, in my community, and I would take a little bit of a pay cut. Like, whatever. Yeah. To work close to home, to work for somebody who I know the owners and I know the customers.
And to stay a part of my community that I grew up in.
A lot of people would be willing to take a little bit of a pay cut for that, and a lot of small businesses could offer competitive pay, but they can't.
Cheaper to live in those communities, presumably, than the big city. Like, people wonder why people go to the big city all the time. It's because you literally have to these days if you want to exist in America.
No. Absolutely. And
if you care about rural communities, if you're in a rural community and you want to keep existing in the next 50 years, like, this is a big barrier to that happening, to happening that work.
Where I live, where we're recording right now in rural Minnesota, an hour north of the cities, I commuted for years to the cities to work. Emily, my wife, commuted for years to the cities to work. tons of people I know, I'd say probably the majority, honestly, commute an hour-ish
Hmm.
to the cities because that's where.
Gosh, it was just so long. Like
Mhm.
we actually put out an offer on a house around North Branch
Mhm.
recently. We didn't get the house, but it would have been like a 50-minute drive
Yep.
to North Metro, not even
Mhm.
like downtown.
Yep.
Like,
Yeah, it's a long drive, but that's what, like, if you want to live in the community that you want to live in and still be able to afford to work, that's a problem. And that's a problem that's largely created because healthcare is not available. Like a lot of the
yeah,
small businesses around here, they can't afford to provide those benefits, and they may be able to afford a competitive wage,
right, right.
but
But
they can't take on, they don't have the labor pool to get decent healthcare options for their
right.
employees.
If you've ever looked at like your paycheck and like your employer is giving you like a full breakdown of
Mhm.
like the cost of having you as an employee
Yep.
plus your salary, like they're spending thousands and thousands of dollars just to give you the ability to have health care.
Yep.
Not even like to pay for it for you, just to
Mhm.
give you the option to start
Mhm.
paying the premium yourself.
Yep.
So like it's costing a good portion of what it costs to just have you as an employee just
Mhm.
to have the ability to give you health care.
Yep.
Like that's a huge barrier to attracting better just any
Yeah.
any labor
Mhm.
whatsoever.
It absolutely is. And then without quality labor, that makes it exponentially more difficult for you to compete with these
Right.
bigger companies. It
Yeah.
is already difficult to compete with. And that kills small businesses. I
Right.
mean, if it stops them from getting off the ground altogether, which it often does,
Right.
it stops them from
Yeah,
being.
most small businesses fail within the
Mhm.
first 5 years for a
Mhm.
reason,
And this
partly
is
because of this
huge reason.
healthcare.
A
Healthcare
huge reason.
costs.
So if you want competition, and competition's good, like competition prevents this greedflation,
Right.
and all that because you have other businesses to compete with.
Yeah.
And at this point, the rate that the big businesses are charging us, a lot of small businesses could operate cheaper, like
Yeah.
goods and
Yeah.
services cheaper than the big companies if they could have the resources that they need to just do business. Um, and then, but that's why major corporations and the U.S. military is another one. Like joining the military is a big reason that people join the military for healthcare access a lot of times.
Right. Yeah, I know that I when I left, they were like, you should keep paying for your military health care
Mm-hmm.
once you leave because as long as you keep paying it, you get to keep it and
Mm-hmm.
then you get like access to the VA. And I was like a 20,
Mm-hmm.
5-year-old, 24, whatever. And it was like $100 a month or something like that. I was like, I'm okay. Like, I don't need it. I'm not going to need it for the next like
But you kick
20
yourself
years.
for that a
I
little bit,
mean, I don't know. I haven't really
right?
needed
Yeah,
it
I
in the
suppose.
last 10 years. So
Mm.
luckily, it probably has come out to my advantage. But like,
No.
yeah, it's a real thing that people discuss
Mm-hmm.
about the military is
No.
try care is what it's called.
Mm-hmm. But I mean, that's why we run into these obstacles of getting universal health care, like literally every other fucking country on the
Right.
planet,
Right.
is because the the U.S. military's recruiting is education, healthcare, housing. That's what is a big draw for them. And then corporations, they don't want the competition. They can afford to foot the bill for it to make sure that they don't get that competition that would lose them money, and they don't lose their qualified workforce. And that that's a huge problem. And I don't know what the solution is to overcoming that one. Uh, because there's a huge, huge amount of money in lobbying to keep things the way they are for
Yeah, I
these
mean,
reasons.
with almost every issue that we talk about
Mhm.
is this just and pervasive issue of just politics in general is lobbying and money. Like
Mhm.
we have a whole episode on it for a reason.
Yep.
It's a huge fucking deal, and it's obviously hindering our ability to do anything that's useful to fucking anybody. But yeah, this is one of the big ones, and that's why we want to talk about it, especially part of this series as
Mhm.
living the American dream, or is there
Mhm.
even an American dream anymore? Because
American Nightmare. That's what the fucking catchy title was last time when we were.
is that I think that might be the next episode.
Oh,
But
maybe. Okay. It's all running together.
yeah, no, it is. I was just trying to find any sort of stat that was like, how much less would this cost you as a consumer? And I keep finding these numbers about like how much less it would cost, like total healthcare costs. Like
Mm-hmm.
we're not right now we're paying like 13 grand. Like it would cost
Mm-hmm.
us like closer to like 10 or 11 grand per person. But that's not like you're out of pocket per person. Like
Right.
so it's like
That's what.
it's really difficult to say like this
Well.
is the number that you're paying now
Mm-hmm.
generally. This is the number what you're going to be paying.
Yeah.
It's like that number is very difficult to find.
Mm-hmm.
But
Yeah.
it generally, even though you're going to be paying more in taxes, you're going to be paying less upfront every month. And I mean, just by God, the stress
Oh my
of the
God.
fucking insurance like process.
Like, yeah, you just think about it. Like, how much better would it be? Like, even if we're paying a little bit more, which you wouldn't. You'd be paying less overall. You might pay more in taxes, but overall, out of pocket
Right.
expense, you'd be paying less,
Even if you're paying the same,
even
like
if you're paying the same.
if you're going to get potentially better healthcare or at least unlimited access to healthcare, which you
Yeah.
didn't have before,
Mm-hmm.
and you don't have to fucking worry about how am I going to pay for this? Am I going to, should I call for an
Mm-hmm.
ambulance? Should I, go get a checkup? Should I go
Mm-hmm.
refill my prescription
Yeah.
here? Like,
Well, and every time people talk about like the negatives of universal health care and claim that like Canadians are flooding across the border for that sweet American health care,
Right.
which is bullshit. In fact, Canada is the #1 company for medical tourism,
sure.
which is where people go to get medical care. And that's mostly Americans
Right.
going there to
Especially for prescription medicine,
Mhm.
prescription
Yep.
drugs.
And then like if we had the best healthcare system in the world, why do all of our fucking grandparents go to Mexico to get like dental care and
Right.
shit? Like,
Yeah.
And but they always talk about, oh, you're waiting in line forever to like get medical work done and stuff, and it's like, have you been to the doctor
Yeah,
in the United States?
you're waiting a month to get a fucking appointment nowadays,
Yeah.
anyways.
And like I've had very limited experience with the healthcare industry because like obviously I haven't done much.
Well, you also just don't go to the
I just don't go.
when maybe you should.
I should probably. But a little over a year ago, the day before New Year's, I was sick and I was maybe doing a little bit of self-medicating and regular medicating. And I was at my buddy's house in his shop, and I was standing up, and then decided that I wanted to sleep, while standing up, and I was no longer standing up, and damn near knocked my 2 front teeth out. Like they were like pointing out of my face, and like I shoved them back in my head, and we went to the emergency room that was like, yeah, we don't do dental stuff. Basically, here's a tetanus shot. Good luck. And
But just remember, teeth are important.
Mhm.
I've heard that.
That's what I've been told.
Also, you don't want to look like a dumbass
Mhm.
losing your two front teeth.
Right, exactly. And so I like, was trying to figure out a dentist I could get into, and everyone he called around, oh well, we don't take your insurance. Oh well, we don't take, we're not accepting any more clients. And it took me like 2 weeks to get into just a regular dentist. And I go in, and they're like, yeah, you need this type of brace, and we could do that, but the insurance you have, because I had poor people insurance at the time, they're like, the insurance you have doesn't allow us to do it. You need a dental surgeon to do it. So I'm like, let me get this straight. You could do it.
Right.
The thing I need done right now, here today. Like, yep, but you can't because my insurance company says that they need somebody else to do the same thing you could do. And they're like, yep. And then, so they're like, here, we'll refer you to this person. So I called that person. They're like, yeah, we don't take your insurance. I'm like, cool, thanks for that.
Yeah.
And so, like, I called around a bunch of places. And then it took me, like, another 2-3 weeks to finally find a dental surgeon that would, like, see me. And by that point, I had just literally shoved them back into my head and, like, kept holding them there with my hand. And they're like, yeah, it's kind of healing. Come back in a month, and if your tooth's not dead, then you're good, I guess. And if it is, then we'll maybe do a transplant, I
Sure.
suppose, or like a fucking fake tooth
Right.
or
Implant.
and yeah. It didn't die somehow, but that was the American healthcare experience.
Right. Yeah.
It took
Yeah.
an incredibly long time.
And your own like time while you're in pain and
Right.
like to research how the fuck to deal with this.
Yeah, I searched it took me hours and hours and hours of calling people and asking
Right.
questions because nobody, even the people you call, don't have the fucking answers.
No.
I got really lucky. One of the people who like worked for the Min Healthcare or
Yeah.
whatever thing,
Yeah.
she was really nice and she put in the extra legwork
Mm.
to find. Otherwise, I was ready to give up. I'm like, everything's a runaround. Like, call this person, and they're
Yeah.
like, well, no, you
Yeah.
need to call this person. And pretty soon, I'm calling the same person again, and everything was a runaround. And like that was that's the healthcare industry in the United States.
Well, right. And like the system has existed this way for too long, and it
Mhm.
clearly isn't changing. It isn't getting any better. In fact, it's kind of getting worse.
Mhm.
And so there's no reason to believe that the way that things exist today are going to get any better in our current system. So
No.
we need a drastic change. Clearly,
Mhm.
we do. We need drastic change in a lot of different areas, but in this one specifically,
But nobody wanted to listen to Bernie.
yeah, nobody wanted to listen to Bernie. He was crazy, don't you know?
Crazy, yeah, crazy socialist. It's like, oh, everybody
Yeah.
should be able to not
Even
die.
though he just wants a socialized, capitalist democracy that we
Yeah.
already have, just like a little bit more socialized. Like, God
Right.
forbid, not even like asking for anything fucking
Like
insane.
Bernie Sanders is a fucking centrist anywhere else in the
Yeah,
world.
he's a sock dem. He's a socialized democrat. He
Yeah.
says he's a democratic socialist, but he doesn't actually believe in anything that like socialists would believe in.
Right.
He believes in basically everything about capitalism, but just a little bit better social safety nets.
Yeah.
Which is like, I love you, Bernie. Like,
Mhm.
you're the best candidate we have.
Yeah.
But you're still like not as far, as we need
Right.
to see some like
It's
massive
just
societal
funny
changes.
that's the extreme left is like
Right,
let's
yeah.
let's just
Bernie's
do most of the stuff the
insane.
same, but like stop people from dying
Yeah.
and spend more money so they
And just like invest in their lives. It's like,
Mhm.
it's weird. I don't know. Like, I guess that could be better. It's weird.
Now he just put sorry, off topic again, but now he just put forth a bill
Yeah, the 32
32
hour work week.
Yeah.
Yeah.
I love that man. So he's
Yeah.
like, you know what? I
Yeah.
know it ain't gonna pass, but I'm gonna keep putting the shit forward.
Yeah.
So you all can see who's voting against you, like who like hates you and doesn't want you to be happy.
Right.
Like,
No, Bernie is the man.
Mhm.
He, like I said, I don't think he goes far enough for what we're looking for as far as like
No, but anybody who
substantial
did go
change.
far, obviously he's not far enough, and he still can't even get anything done because it's
right,
too radical.
Yeah, the things that he want to do are too far to get past, and we're like, yeah, like he could still do
Mhm.
some more.
So
So,
anybody who is even more to the left of him would be
right.
Yeah.
I mean, that's why everybody was like, AOC's the devil.
Mm-hmm.
The Green New Deal, it's gonna ruin America. It's like, it's really actually like a page and a half document.
Yeah.
That's just like, hey, like we should treat people the same, and poor people should get the same access to,
Mhm.
living that
Mhm.
rich people get at the bare minimum. But, anyways,
Mhm.
just to wrap it up, I mean, obviously, United States healthcare system costs too much.
Mhm.
We get the worst care for per capita. The system is purposefully complicated by insurance
Mhm.
companies. It's purposely stressful. There's just no
Just
good thing you
no
can take
redeeming
out of
quality.
this. Like if you want to say like, oh, we have the best like Mayo Clinic and like the highest tech procedures, I'm like, cool. 99% of America will never
Mhm.
see the benefits to those in the next decade.
And we would still have those. Like, we're not saying get rid of those. You can
No.
even still have privatized operations that go after this
Yeah,
kind of stuff.
Germany has private healthcare to supplement
Mm-hmm.
their universal insurance.
Mm-hmm.
So like there's a way to work this that the richy rich still get their fucking insane shit, but
Mm-hmm.
regular people just get the freaking like care that they need to exist and not go into bankruptcy for receiving healthcare. It's
Yeah.
that simple.
Yeah, it really is. In fact, it's funny that you mentioned that because my father-in-law is a pharmacist,
Hmm.
and he kind of preached the privatized version of healthcare because you know most prescription drugs come out of the United States, and most like major healthcare advances come out of the United States because the profits the profit driver or whatever.
Yeah.
And this was like right when COVID was like starting, and he's
Mm.
like the Pfizer vaccine. I'm like, that was the fastest one to market and all this, and I was like, you do realize that was developed with Germany, and I forget what the German pharmaceutical company. I'm like, but it was also a country with socialized healthcare that
Right.
like did like half the work on that vaccine. Like, it wasn't just the United States,
Right.
and it was also the United States spending loads of government money
Right.
to make that happen. I was like, if we wanted to like if the government came out and like, we want to cure cancer and we are going to spend money like we spent, like they said, we want to go to the moon. We like barely put a man in fucking space.
Right.
And then JFK is like, we're going to go to the moon because it's hard, and we're going to do it in like less than 10 years. And then we
Yep.
did that because we're like, you know what? We are just going to keep throwing money and the smartest people at this shit until we figure out how we're getting there. And then that's what we did. If we just fund these things, like think about it, all of the major technological advances, or most of the major technological advances and high-tech equipment that we've had have come out of the aerospace and military industrial complex, because the United
Yeah.
States government is like, I want a fighter jet that can like outperform everything on the planet,
Right.
and I want the fastest plane in the world. Nothing's ever
And I want the
outperformed.
best telecommunication
Mhm.
systems with
Yep.
the best internet
Yep.
and satellites and like all that stuff.
Mhm.
It comes from defense spending, but what it really comes down to is it comes to government funded research.
Mm-hmm. Yeah, it's not privatized. It's not like
Yeah.
companies competing to what they can make a profit on. And then they do that, and then they sell all the shit. Like, so like the microwave was invented by NASA.
Sure.
MRIs, like all this stuff came out of our space program, and then they sell the patents to private companies that then make a fortune off of us. Fucking Velcro and like shit, all aerospace stuff. GPS is still managed. The entire
Right.
global positioning service system is managed by the U.S. military.
Right.
All of your weather apps, that comes from government managed
Yeah, like 90% of it is government owned. Yeah.
and operated, and then they charge us for doing. They just repackage it in their own like thing, but all of that shit we paid to develop. Like, that was not
Right. That's
private.
tax dollars, baby.
That was not private industry inventing this shit for profit. That was the U.S. government being like, this is what we want, and then companies being like, hey, you should give me some of that.
Yeah. Well, and I mean, it's your uncle with the whole pharmaceutical industry.
Mhm.
It's like, okay, so like maybe they come with a few drugs that are really
Mhm.
good, but also they just repackage the old drugs every year right before the patent's about to expire
Mhm.
and say this is a different drug that does
Yeah.
the same fucking thing. And
Mhm.
so they just like, yeah, there's
No.
that whole fucking thing.
No.
Anyways, I don't know. We've basically said what we need to say.
Yeah. There's no reason not
Say
to
what
do
you
it. That's
need
what
to
we're trying to
say.
say. Is there's not a single argument
No.
against changing the system to a more universal healthcare system like the rest of the world. It would cost us less. It
Yeah.
would be better for the economy. It would be better for the free market. It would be better for small business. It would be better for people's health, longevity. There's no. It costs us less. Like, there's
Right.
there's nothing. There's
literally will be cheaper.
Mm-hmm. There's absolutely no argument against it, and at this point, if you're arguing against it, I don't know how your brain works.
Yeah, I mean, we'd love to talk with you about it, I guess.
Mhm. Yeah, I
If
would definitely
if you
have.
made it through all this and you're
Yeah.
like, nah, I still don't believe you.
Yeah, if you're at this point, we would have you on the show and
Yeah.
be like, please enlighten us on why you
Right.
think that this is the system we should forge ahead with.
Yeah.
Yeah.
Well,
All right. Well, guys, we appreciate you sitting through this. We've got
Mhm.
2 more episodes, I think, in this
no,
series.
this is the one more. We have
One more episode
kind
in
of
this
the
series.
wrap up
Yeah.
episode and just kind of the overall
and then we're gonna umbrella cap this, kind of tie it all together,
yes,
and
yes.
then move on to something else. Hopefully, more interesting and whatnot. But this was a topic kind of requested by somebody who listens, and we appreciate it. And we're trying to hear what you guys want to hear about. We do this because you, for some reason, enjoy sitting and listening to us ramble on. I'm not sure why, but I don't judge, and we
Hopefully you get
appreciate it.
like
Yeah.
like a little smile, when
Yeah.
you're at work or whatever, you're mowing
Mhm.
your lawn, whatever it is.
But yeah, no, we appreciate you guys sitting here hanging out with us, listening to us, allowing us to do this. It's a cool thing that we really enjoy and appreciate. As always, you can support us if you want to buy merchandise at
Yep.
offjawagon.com. There's Let Them Eat Toast merchandise as well as my own merchandise. You can follow us on the TikToks, both Let Them Eat Toast and Off Jawagon, as well as every other social platform, Facebook, YouTube. Now with TikTok on the chopping block again, it would be really appreciated if you
Yes.
followed us in all those places. And you can if you want the video version of this podcast, we do post that on YouTube as well.
Mhm, mhm.
Uh, anyway, once again, guys, we appreciate the hell out of you for sticking with us through this whole journey, and we're enjoying it. And hope you keep getting something from it.
Yeah. Thanks for tuning in. We'll see you next week.
See you next week.